Shoulder impingement. It's a very common problem that we see in physical therapy quite a number of times with regards to shoulders, and it really comes on for a number of different reasons, but some common reasons why you will experience shoulder impingement is that there's a lot of tightness in and around your shoulder, whether it be in the muscles in the front or the muscles in the back. Those same muscles sometimes can be very weak. Most commonly, that tightness and that weakness closes the space between the ball, the top of the head of the humerus, and the collarbone, and it closes that space. And what happens is any one of three structures get pinched on, whether it be the bursa, your rotator cuff tendon, or the cartilage will get pinched on, and that's what causes pain. And that pain will present itself as an ache in either your shoulder or your upper arm down into your elbow. It'll also turn into a sharper pain when you reach for something. And that over time leads to a decrease in motion. You can't reach as far, you can't reach behind you, things along that lines. So what we always like to do is give you a way to make sure that you can kind of test for yourself, is this something that might be affecting you? So the way you can test this on yourself, it's very simple. The shoulder that you think you might have this problem on, take that hand, put it on your opposite shoulder. Keeping your hand on your shoulder, slowly raise that elbow up. And the goal is to raise that elbow up to chin height without lifting your hand off your shoulder. Now, as you're raising up, you may start to feel some tightness or some pinching or some soreness down that arm. And if that's the case, that's a positive test. The goal would be keeping your hand on your shoulder to be able to raise that elbow to chin height and not have any symptoms of pinching, soreness, tightness, pain, anywhere from the shoulder blade, and down into your arm. What can really be done to help that is you've got to open that joint space up. You've got to get the pressure off of that tendon, off of that bursa, off of the cartilage, whatever it is. That's where some specific exercises come into play to stretch things, to strengthen things. That's where maybe potentially some manual therapy in terms of a physical therapist doing some joint mobilization to open that joint up, some modalities to try to decrease the pain, and then overall some strengthening to keep that joint space open and keep you in good shape. So Loudoun Sports Therapy can definitely help you with this process. Give us a call.